guys, this is Sneha and in this video I'm going to talk about assisting the patient to deep breath and coughing. Let's go! Hi.
Hi,
So what's your name?
Robson.
Okay. Well, how do you feel now?
And thank you.
Okay, Robson. So my name is Sneha Kantipan and today I'm going to teach you about the deep breathing and coughing, which is very important once the surgery has been done so that your lungs will be clear.
What I have to do?
Okay. So right now actually I wanted you to sit up nice and straight. Okay, good. So and now I wanted you to breathe in through your nose and then out through the pursing lips like this. Okay, good. And now I wanted you to do it much more deeper so that your ribs will be expanding sideways so that your lungs will be filled up with air. Like this. Okay, good. So I want you to do this 2 more times. Okay, good. So now what I want to do is to breathe in deeper and I want you to hold it like to count for 3 like this. Two more times. Okay, that makes sense. So along with this deeper breath I want you to cough 2 times. So that I prefer you to hold the pillow against your incision so that it will be comfortable for you. So what you have to do is like you have to do like okay, so do it 2 more times. Okay. Okay, very nice. So that's it. So do you have any question to ask? Is it important?
Is it important to do this?
Yeah, it's extremely important to do this because once the surgery has been done and it helps you to keep your lungs very clean and it's very important. So you have to do it like 2 to 5 times within an hour in a day. So even when you go discharging from your house, I would like you to recommend to do it like within a week. To do 2 to 5 times in a week. Like it's nice, it's good. So thank you for your cooperation.
Thank you.
Bye bye.